Hi, Brooks.
Hi, Rosina.
Hey, hi, good morning. You can see me, huh?
Yes, hi.
And hear me too.
Yes.
Oh, that's great.
Hi.
That's
How
good.
are you? My mask. So you won't be joining us here.
Yeah.
So I added your slides. I added
Okay.
your slides to the presentation, so I'll share my screen, but then when it's your time, just um, unmute your microphone. Okay?
Oh, when it's my turn or what?
Yeah, when it's your turn. Because I have all the slides together.
Okay, so I'm not talking or what?
Yes, you are. You are. But that's what I'm
Oh,
saying before
oh,
it'll pop
unmute.
up
Okay.
and muted.
Yeah,
Yeah.
yeah, yeah, yeah. Okay. My mind is early morning woke up right now.
Me
So
too.
I said, if I mute it, then
No, you'll be good.
yeah, okay, that's good.
Okay, I'll be back. I'm just going to set up the presentation here.
Right.
My lighting. Very good lighting here.
Yeah.
A little better. A little bit. Okay.
Bird flu. So there's always been something that's been coming up or simmering on the horizon. Obviously, nothing as significant as COVID-19. This morning, the latest count was around 96 million cases around the world and close to about 500,000 deaths. So it is of significance, particularly the way it's paralyzed our life. So we're going to have here Dr. Bardal, who's a radiologist, talk about some of the imaging findings of COVID-19. I would give you a brief perspective on where the role of stem cells is in the treatment, because as of now, as flimsy an evidence we have, stem cells is the only treatment that has shown to have some resolution. So even as we wait about finding the right drug or a vaccine, this might be a perspective that we should at least be aware of. Brooke will talk about some of the assistive devices, such as the role of light therapy and photobiomodulation. These are non-invasive techniques focusing on regeneration and repair, which can certainly help a fair number of patients. And then Dr. Conley here, the LA Chargers team doctor, he's going to give his perspective on diet and exercise, nutrition and exercise in order to combat this. Because let's be honest, at the end of the day, in any fight against any disease, it's extremely important how healthy our body is and how well we take care of it. And if we can learn something from this crisis, that is going to be the most important take-home message. I'll now invite Dr. Badal to talk about her experience of imaging findings for COVID-19.
Thank you, Dr. Goswami. Yeah, I'm Dr. Rosina Badal-Munir, and I'm going to talk about the imaging in COVID-19. Now, as we all know about the imaging, that there are different, that imaging plays a very important role in the acute care of the patients with both the suspected or the confirmed COVID-19 cases, right from the early presentation when the patient goes to the hospital all the way till the patient is discharged. So the different modalities which are used in radiology are the chest X-ray, CT scan, and point of care ultrasound, and the ultrasound guided procedures, and then the MRI. Next slide, please. Just few words about the CT chest. I'm not going into the details. I'm just going to have a quick review of every modality. So the chest X-ray, the chest CT is considered as the gold standard of the COVID-19. This is a very high sensitive exam. And the findings on the CT are the typical ground glass opacities with the peripheral distribution. So if you can see over here, the peripheral distribution and the mostly infusion and posterior lobes are involved. Pleural thickening and pleural effusion are some of the complication of this condition. Then we come to the chest X-ray. The portable chest X-rays has make it a little bit easier for the patient to avoid the transfer of the patient. But the chest X-ray is insensitive in the early disease conditions, but at least it is very helpful to establish the baseline and the follow-up imaging for the disease progression. So if you can see on the chest X-ray, we also see the hazy opacities in the cases which are a little bit progressed, but in the early cases, it is not very sensitive. Next slide.
There it is.
Okay, the role of MRI for the COVID-19 is also seen. It is also a very important modality because in COVID-19, what happens that there is a cytokine storm, and this cytokine storm results in the damage of the blood-brain barriers, which results in the damage to the brain. So we have seen the cases where the encephalopathy occurs, and the MRI plays a very important role in evaluation of those conditions. The common condition or manifestation is seen is the hemorrhagic posterior reversible encephalopathy syndrome in the COVID-19 infection. So the MRI is also very important role in the COVID-19 evaluation. So now, whatever I have talked about, like the CT, X-ray, and the MRI, all these modalities have some challenges and their limitations because of the availability of, because of the accessibility or affordability. The patient is that transferred. These are all academic procedures, and variations are also involved, such as in CT and the X-ray. And the most of all, the disinfection and the PPE is another very big challenge, which is faced by the healthcare professionals when they are doing with these modalities of the imaging. Next slide. So in that case, the ultrasound plays a very important role, and because I'm an ultrasound specialist, so I'm more also involved in the ultrasound. Ultrasound is very easy. It is quick, fast. It is there's no ionizing radiations are involved. And now with the use of handheld devices, it has made the ER physicians or the attending doctors very easy to check their patients right from the beginning and with the time to time. And plus the disinfection is very easy of these handheld equipments. They are wireless, they are compact, and they are also cost effective. So the handheld devices, ultrasound devices, or are also the ultrasound, the big conventional machines, they all play a very important role in the evaluation of the bedside exams of the patient. Next slide, please.
1 second, Rosina. I'm seeing that people aren't able to hear it, so just give me a second. I don't know what's happening.
I see. Can they hear me or what? Because I haven't seen what's on the.
It said on the chat that they couldn't hear, so I don't know. Can anybody hear? Yeah, I don't.
Brooke, hi, it's Kathy. I can hear you.
You can. Okay, thank you, Kathy.
Yes,
All right, so Rosina, I'll do the next slide, but everybody will continue. Thank you.
Okay, that's fine. Okay, So as I was talking about that handheld devices have made it very easy for the evaluation of the patient by exams. So the ultrasound has a characteristic findings we look for the patients of the COVID-19. The characteristic findings are that we look for the pleural lining. Pleura is a membrane which is covering the lungs. So as this disease, the lungs are involved and the peripheral areas are more involved. So we see that we can see those changes very easily with the help of the ultrasound. So if you look at over here, this is the normal pleural lining, but in case of the COVID-19 patients, we have seen that the patients get the pleural thickening, and there's also the irregularity. You can see the smoothness over here, and you can see the irregularity over here. Another very common characteristic finding in the COVID-19 patient is the B lines. So B lines are the vertical lines, and they are like a collage. They combine, and you can see this white band type of areas in the patient lung who is suffering from the COVID-19. And in cases where the patient gets the pneumonia, so you can see the consolidation, subpleural consolidation, such as like this over here. So these are all the some of the common findings that you can see while evaluating your patient with then another role of ultrasound is very important also in the doing the point of care ultrasound, point of care exams, such as examining the patient heart. Most of the patients who come to in critically ill patients who come to the hospital, they have some underlying disease, cardiac disease. So by just having a quick bedside exam of the heart, you can see the functions of the heart, and you can also have an idea about any other pathology, which is pre-existing pathology of the patient. Ultrasound also have a role in the ruling out the DVT and looking out all the other organs of the patient. Another very important role is the performing the guided procedures, because you are looking at the real-time anatomy when you're performing the procedures. Next slide, please. So overall, I would say that all these imaging modalities are very important, are playing a very important role in the evaluation of the COVID-19 patients. And all the major radiological societies have strongly recommended that using any of these modalities, the caution should be taken in this scenario. So with this, I say thanks. And if there's any question, you can just put it on the QA box. And thank you so much. Thank you, everyone.
Thank you, Rosina.
This. Welcome.
Okay, Dr. Goswami will be speaking now.
Hello, again, good morning. So what is coronavirus? Coronavirus actually exists in our body. There are coronaviruses. The bird flu was a coronavirus. It's a family of viruses. This one is a little different, I guess a lot different, and that is why it was given the designation of novel coronavirus. COVID-19 originated in 2019, Wuhan, spreads through respiratory droplets. That's the only method that so far has been known. Does not spread through inanimate objects or through food or through other contact. Obviously, the goal here is to wash your hands so that anything from the air or things you touch doesn't carry the virus. The frequent washing of hands, and then where physical distance is not possible, wearing a mask is the only strategy. There is a mad rush to obviously develop a vaccine, and that will come in due time, and I hope it doesn't come at the cost of compromising our health and safety. So those things do require time to be properly tested before they're made available. In the meantime, the scientists in China were obviously the first ones to deal with this problem, tried to tap into the potential of our stem cells. Now, just a little brief on stem cells. What really do stem cells do? I mean, there are two kinds of cells in our body, the regular cells, which have a certain lifespan, and stem cells are the seeds, which are constantly replacing those regular cells. But stem cells also carry another important property. They are capable of self-renewal. So our stem cells don't die, they constantly self-renew themselves, and then they create other cells. And over the years, and this is a knowledge we've known for 20 years, that stem cells have some very powerful anti-inflammatory factors. They carry a whole bundle of chemicals and processes that are known to help with inflammation. And inflammation is the fundamental basis of a lot of disease other than cancer. And that's a whole different discussion, because now in cancer, we're trying to kill cancer stem cells because they're causing so much overgrowth of the tumor. But coming back to non-cancerous conditions, inflammation, infection, trauma, injury, any kind of disease, the stem cells have the potential not only to replace cells, but also to suppress inflammation. So these guys, Professor Zhao and others, took about 7 cases. They had a total of 10 cases. 3 were in the experimental arm, took 7 cases and treated them with infusion of mesenchymal stem cells. And within 2 weeks, there was significant resolution. In fact, all these patients survived. Obviously, that's why I used the word flimsy in the beginning, that this is very little evidence, just having a collection of 7 or 10 patients. It's not going to convince the scientific community, but there is such low downside to the potential of stem cells that I think it's an avenue worth exploring. Obviously my practice has largely focused on treating sports injuries over the last 10 years, and I use patients' own stem cells. But certainly I think they have a larger role to play as we continue to manage conditions. So basically, what are the sources of stem cells? So we're still learning a lot about this. There's definitely different sources of stem cells. Bone marrow, fat are the commonly used sources of stem cells. The stem cells can also be harvested from pregnant women, from umbilical cord when the baby is delivered. We're not talking about embryonic stem cell, which is a whole different concept, which obviously has some moral and ethical implications associated with it. But we're talking about cells, we're harvesting cells from sources where there's no sacrifice of life or no damage to the donor. So those certainly are. There's still a lot of debate about how best to administer these. Obviously, you can harvest cells, they have to be processed, they have to be cleaned up. There are also some ways where they can be multiplied into large number. I think in the China study, they were administering about 1 million stem cells per kilogram of body weight. So if somebody is weighing around 70 kilograms, that's 70 million cells is what they're getting. So then we're talking about, I'm hearing an echo of my voice. Talking about the method of delivery. In that study, obviously, IV method, intravenous method was used. There is some debate if that is the right way or not. Obviously, it's worked in this patient. Sometimes we can do an endobronchial, endotracheal, because this is primarily affecting the respiratory system. And I'll address in a minute why it's so centered on the lungs and the cardiovascular system. There is intramuscular and subcutaneous administration too. Next slide. So this was just to give you kind of the spectrum of what happens is that we have figured out that coronavirus actually gets attracted to the cells which carry a particular enzyme on their surface. It's called the ACE2 enzyme, which is angiotensin converting enzyme 2, which is basically found on the cells, surface of the cells in the lungs, the cardiovascular system, our heart and blood vessels, and kidney, and the digestive system, the intestines. And that's why most of the symptoms have been associated with these organs, involvement of these organs. So it's going to be extremely critical to develop, therapeutic strategies, not only on using stem cells, but also maybe programming cells and drugs that can specifically work on either blocking that enzyme or not letting coronavirus get into, and there's significant amount of research going on that front. So fundamentally, it comes down to what does a stem cell do? And this is, again, I like to compare it to Tesla's electromagnetic theories and science of electricity, which we've known for almost 30 years, but it still took us a lot of work for people like Steve Jobs and Elon Musk to come and make them marketable products. But this is from the first textbook of physiology that I went to medical school, and I don't want to date myself, but it's over 20 years old, which says it regenerates and replaces dead cells. It slows down the breakdown process. It improves blood flow. It releases valuable growth factors, enzymes, anti-inflammatory in action, and it also modulates the body's immune response. All of the things which are critically important when we are fighting disease. So what happens is, on a cellular level, what's going on, and we have to start looking at conditions, it's how they affect cells, not just the gross manifestation. So a cell is like, again, like to compare it to the pixel of your phone screen, right? All of those pixels have to be in healthy for you to have the resolution you're looking for. Similarly, your body is comprised of millions of cells, and they have to work in sync. Most of the time, these cells are capable of self-healing when the insult or the injury is not significant. That's how we survive. That's how, on a daily basis, we interact with organisms and germs, which have the potential of causing us harm, but they're not as potent or they're not as unique as the coronavirus is, and we're able to ward them off. We might feel a little bit tired or have some symptoms for a few days. We rest and recover. Same thing happens when we twist our ankle or sprain our knee. We rest and recover. That healing is taking place on a cellular level. It's when the disease, especially in coronavirus, viral load, that's what we're looking at. That how come people can get infected with coronavirus, but not everybody obviously gets the severe form of disease. Not everybody is dying. And the reason for that, still trying to find the reason, but at least on the surface, the reason is A, the viral load, how much virus gets into your body. B is obviously how your general health is. And again, there is, if you have an underlying comorbid condition, just like any other medical problem, you're likely to suffer more. So when the cell gets damaged, releases chemicals, causes inflammation, causes the symptoms. Where do we get the stem cells? So you can see entire human development spectrum from the time we were a single cell in the embryonic stage to our adult cells. We are potential sources of stem cells. Now, in some situations, obviously in the athletes, we use their own stem cells for coronavirus or some of the other medical challenges, Parkinson's disease. There's lots of research going on because millions and millions of cells are needed there. So we'll have to clearly tap into outside sources, and there will be donor cells, but they can be cleaned and programmed in the laboratory to function in the way we would like them to function. Limitation of stem cells, again, this is not a sales pitch for stem cells, but clearly, we are missing the boat if you're focused so much on drugs and surgeries, if we don't tap into the potential of stem cells. And a lot of that potential we're still learning. Where are the different kind of stem cells? Because I have patients who come to me and say, oh, you treated my knee, I'm doing so great. Can you treat my aunt's diabetes? Well, we're not there yet. Those same cells which are healing your knee is not going to produce insulin and start helping a patient who has diabetes. So a lot more understanding has to be understood. The applications that are advancing, the dosage, how much dose is needed It's still a wild guess, but I do anticipate in the future, just like we've done with pharmaceuticals, we'll probably have a good understanding of how many stem cells are needed to treat what condition. And the risk of stem cells, let's be honest, anything that man does or any intervention that we do does have a ripple effect. And we are safest when we use our own stem cells in the same day, same sitting procedure, but obviously can only treat certain conditions. But the risk of stem cells clearly has to be understood. But so far, preliminary data with using stem cells across the board, not only just for COVID-19, but for other conditions, has shown a very, very high safety factor. Why do we still hear about stem cells with skepticism, which is good, because anything new should be held to a higher standard. But the problem right now that is also engulfing the world of stem cells is the mass marketing and people out there aiming to be doing stem cell treatment. There's such a lack of standardization on how the cells are collected. Are the cells viable when they go into your body? What is the number of cells? And I've had patients who've come to me and they've had treatments where 0 stem cells were injected and they were still told that they had a stem cell treatment. The sources of stem cells are extremely important to understand. Different products, commercialization, unfortunately, gets way ahead of where the science is. Doing treatments that clearly lack regenerative capacity because you have a poor understanding of stem cells. So these are all important things to keep in mind. So I don't necessarily blame when people say, oh, it's just bogus, but no, there is good science to support it. And I think we should continue to encourage the development of that science. Stem cell facts, again, just repeating what I just said, all stem cell treatments are not the same. All stem cells are not the same. More than one stem cell treatment may be required. Stem cell treatment do require that you take care of your body. And stem cells, as much as we would like to think of as the holy grail, and they do not replace organs, at least not yet. They have tremendous capacity to heal your organs. So finally, all I can say right now, as much as I've spoken about stem cells, is that taking care of your body is still your best bet. And how can we do it if we just keep these 5 things in our mind? Very, very important. 20 years, I've done thousands of procedures. That's all I do. And I can tell you, I can technically do the same job and have opposite outcomes. So I do not like to stroke my ego when people get good results. Neither do I get very discouraged when people don't see results, because ultimately it's your body that's healing you. Eat food as a fuel and not because your body has been programmed to eat. All these theories about eating 6 times a day, all these theories about eating once a day. No, you listen to your body, but think of food as fuel. You go to the gas station when you need gas. That's how you need to feed your body. Focus on whole fruits and vegetables. Drink plenty of water. It's extremely essential to keep yourself hydrated. Do some physical activity, and the best way to do that is play a sport. Enroll in a program. Not only you make friends, but how many times you're going to go to the gym and try to force yourself? Whatever you do in life should be natural part of your life, just like in a childlike state. Don't try to make too many decisions on what you're going to do, because the stress of that, which is extremely important. My brother's a cardiologist in Michigan, and he was telling me he's had 400-pound patients, and he does their angiogram, and their arteries are perfectly open and clear. And he's got 30-year-old guys coming all fit and trim, dying on his table, because stress is the #1 killer. Okay, if you cannot manage stress, no matter how healthy you eat, how much physical activity you do, how much you pray in front of God, it's not going to work. Trust me.
You hear what he said? Stress is the real killer.
Absolutely. Remember, being happy is the choice. We always think that something will make us happy. No, you have to first be happy, and then things will happen to you. Thank you so much.
Thank you, Dr. J.
So we'll have Brooke now talk about the fascinating photobiomodulation.
Thank you. Well, I'm Brooke. I'm going to talk about light MD and photobiomodulation. What is photobiomodulation? I'll go through it pretty quickly here, but it's basically the metabolic and cytological response of living cells to photons of light that can come in the form of sunlight, which is our natural ball of energy. We've got plasma tubes, lasers, and LEDs. In this case, we're going to be using LEDs. So for photobiomodulation, when light is exposed, it basically is going to be varied by wavelength, which is the color. We use red, near infrared, blue, green, and violet. It's going to be the irradiance and the fluence, which is how much power and how much energy. So the effect of photobiomodulation can either be beneficial, meaning it can do cellular repair or increase circulation, give it energy in the form of ATP, or it can be harmful by provoking cellular apoptosis. So using, for an example, using blue light or UV light to kill pathogens. So here we have the wavelengths, and we operate in the visible and near infrared spectrum. So that's right in the kind of towards the left of the screen, where the wavelength is in near infrared, and that is where you're going to see the photochemical response. Past that is the UVA, UVB, that's ionizing light, that's going to be harmful to you and DNA damage. So we operate in the range of near infrared to red all the way through violet light. This is what the system looks like that we utilize. It is frequency based. It can be used by multitude of individuals and companies, clinics, physicians, hospitals, chiropractors, athletes. It's good for corporate wellness, senior wellness, trainers, and you don't have to have a medical license to operate it, so you can just be in the wellness field. These are some of the tissues and organs impacted by COVID-19. So you have, starting from the top, your sinuses and your upper respiratory tract, runny nose, get a sore throat, cough. They've even said that you lose your sense of smell, your sense of taste. There can be a risk of secondary infections. Then moving down, we've got the lower respiratory tract, so getting a lung infection, possibility of increasing the chances of pneumonia, or if COPD is exacerbated, shortness of breath, bronchitis, and also a secondary infection. They've also found evidence of COVID in the gut, and this is via diarrhea or upset stomach, nausea, in the liver and kidneys. You'll find it there as well, as your body is trying to process this virus out of your system. So, and the systemic effects is it causes a high fever and depresses your immune system. So pretty much the whole body is affected by COVID. And the way that we address it as a therapeutic strategy, now we obviously cannot cure COVID, but as far as reducing the inflammation in all of these systems, that's where we're seeing a tremendous effect. So by directly treating the respiratory system, the upper and lower respiratory tract, the endocrine system, doing your kidneys, your liver, and the immune system, targeting the thymus, the brainstem, ears, and into the gut and digestive system. So what's beneficial is that the pads are able, unlike medications where you can treat one organ or tissue specifically, doing light can help you treat all of them. Can somebody mute their microphone, please? There's a lot of feedback. So here we have, thank you. Here we have the therapeutic mechanisms. So reducing lung and sinus inflammation and local edema, improving circulation to the tissues and organs, improving the oxygen saturation and nitric oxide. So I actually had a interesting situation in February. I was sick. My oxygen went down to 86%. I was wearing a pulse oximeter, and I did a session on, and I'll show you what it looks like, but I did pads across my, the back of my lungs. And I was watching it and recording the video the whole time of the pulse oximeter. And in 1 minute and 4 seconds, I got my own oxygen from an 86 to a 99 in just 1 minute and 4 seconds. And it stayed there for the remaining of the treatment. So boosting the natural immune response, stimulating leukocytes, lymphocytes, and T cells, combating the viral replication and reducing the viral load in organs, reducing the chance for secondary infections, and protecting the organs like your liver and the kidneys from drug toxicity. So just symptomatic benefits here. Let's go back, sorry. We're gonna improve breathing, as I mentioned, reduces shortness of breath, chest pain, coughing and hacking. Will actually help you to clear out your lungs, managing fever, reducing pain, which is apparently pretty strong in chest pain, sinus pain, sore throats, and then it's super relaxing. It encourages sleep and restful sleep, so where you can heal. This is a little bit of the mechanism of PBM. So you have your mitochondria, which is receiving, basically mitochondria absorbs the light via cytochrome C oxidase, and it's releasing nitric oxide, reactive oxygen species. The production of ATP comes from the cellular energy. Comes from light energy producing cellular energy. And then those biochemicals directly affect the tissues, your nerve tissue, muscle tissue, and the epithelium, the lining of your organs. So you can see just by directly targeting your cells can respond positively to protect the organs. This is an example of what our regimen is. This is for preventative care as well as for palliative care for COVID patients. So we do the front side treatment here on the left. That's the one going vertical from the neck down is the immune system, targeting the thymus, solar plexus, and into the gut.
Treatment they're doing to help people with COVID.
You can see the pads across the face. That's good for the sinuses. We are IEC photobiologically safe. So unlike some light devices that you have to wear eye protection, this one is safe and approved, certified for the use on the eyes. This treatment in the middle is the back of the lungs. That was the one I mentioned within 1 minute and 4 seconds that I increased the oxygen from 86 to 99. And there's me doing a treatment on my neck, and that's good for the throat, lymph nodes, and the glands. Here's another so basically we do a 90-minute session for preventative care. If somebody does have COVID, the doctor's offices that have seen these patients, they're actually doing a 180-minute session with the pad positioning, as I was saying. So this is another one for showing the sinuses. You can do 2 methods. It's either using the 3 pads and going into the ears or going across the face. Here's another one for the back side and doing the back of the lungs. You have a little clearer access than going directly across the front of the lungs. And here's a treatment on the top left showing across the front of the lungs. That's also good because it targets the thymus, which will help with your balance to the immune system. And the throat, the treatment on the neck is good for sore throat, coughing, increasing oxygen, blood and tissue oxygen levels, and combating the microbes. So one of the advantages of this is that it is, like I mentioned, it's IEC certified for photobiologically safe, so you can have the treatment in the eyes. There are no side effects or contraindications. It can be used with medications, so there's no contraindications with medications, and it can actually help them to work even better. Safety glasses not required. There's pre-programmed protocols, and you don't have to, the person operating it can wear a mask, can disinfect all the equipment in between each person, and you can even set the pads down and go on the other side of the room or into another room, so you don't have to be too exposed. This LightMD's treatments can be used alone or in conjunction with other therapies and drugs. It can be used alone, or it can be used as preventative care as well. So this is compatible with any hospital standards of care. It can be administered by physician, nurse, or a trained phototherapist. And it can also, we've been leasing on our system, it can be self-administered at home or while in quarantine during the shelter in place. So thank you, and I will pass this to Dr. Travis Conley.
Good morning. Thank you all for joining us today. I'm going to be covering basically some nutrition, exercise stuff, things we're going to try to boost your immune system, strengthen up a little bit, and help you kind of get your body ready to do some battle with any incoming viruses or diseases or whatever else coming at you. So the point of nutrition, like your basic nutrition outline for anybody, is eating healthy and vegetables and lean meats and good fats and so forth. I'm going to target a few things a little more specific, but you'll see here on the slide, this is kind of a list of some things you want to make sure you cover your bases with. The purpose of nutrition at its center is to get the inside of your body in a healthy environment state so it can fight off these diseases and viruses that come at you. With nutrition, you're going to want to focus on certain vitamins like D, A, C, and K. These are a little more specific to immune function, but you're going to get vitamin E with your omega-3s you'll see down the line there. All of these are very important to get in your body as consistently as possible. Food is obviously the best way to get that in there. You're always going to see something that has plenty of veggies, various colors and so forth. That means you walk into a grocery store, you're going to look around and anything that's bright, orange, green, yellow, grab that and throw it in your cart. When it comes to proteins, we do lean and clean proteins. You can do a plant-based one, but I don't like to recommend soy. Soy has a tendency to cause a little inflammation in the system, so I don't like to put that in. And I'll get to that in a little bit, why that's important. Your good fats, things like avocado, macadamia nuts, and coconut oil are always vital for you. I pick macadamia nuts because every nut has a like omega-3, omega-6, or omega-9 profile. Macadamia nuts are going to have a better profile in the omega-3, which is that healthier side, like omega-3 fish oils would be. So that's why I choose that nut over, say, an almond or a cashew. We get to the no sugar or processed foods. The purpose there is the sugar is obviously, most of us are going to know, very inflammatory to our system as are processed foods. The problem we run into is when you have somebody who has a little immunocompromised, or you might be a high-risk group for the COVID virus, sugar and processed foods will actually cause your system inside, as we talked about internal healthiness, to be inflamed most of the time. So if your body's immune system is going to go fight with the virus incoming, you can't have it fighting inflammatory stuff that you put in your body through food and then try to go get a virus as well. So when it comes to processed foods or sugars, you want to make sure there's none to very little in your body, especially if you're part of the high-risk group, because a high-risk group won't have a lot of wiggle room with this area here. And keep yourself as healthy as possible by eliminating those foods from your body. Now, for a lot of you out there, you may not be sure what that looks like as far as food goes, but we stick with the lean meats, like I said before, the vegetables and the good fats, and you kind of keep yourself centered around there for as long as you can and try to get rid of the sugar vice if you can. Vitamin B complex is the best. Vitamin B is actually have a lot of good functions in the body. The problem you'll find with them is they're water soluble, so you can't really load up on them at one time, because once you take them in, your body's going to utilize what it needs, what it wants, and then it's going to disperse the rest through excretion. So those you'll take kind of throughout the day. It's a great supplement. You can find it in a pill form pretty much on Amazon or anywhere else, and get a vitamin B complex that'll cover a lot of the bases for you. From there, green tea is just one of those things. Like I said, this is just like a healthy thing. Green tea has always been healthy for our body. I'm a coffee drinker, but I do enjoy green tea from time to time. Has a lot of antioxidants to it and anti-inflammatory processes to it, which again, just make a very nice, healthy environment for your body to handle any incoming viruses. Next slide. This is something you can pretty much Google. So you can find anywhere on there, healthy foods for your immune system. With that, you'll see garlic and turmeric. Broccoli is always going to be on there because you really can't escape broccoli anywhere you go. Well, we've got oysters, shellfish, things like that. If you have an allergy to shellfish, obviously you want to avoid those. Your leafy green vegetables, your citrus, and so forth. A couple things to look on here is the water. A lot of people are very dehydrated in their day-to-days. So when you're drinking water, the rule of thumb for you is to go about half your body weight in ounces. So if you weigh 200 pounds, you want about 100 ounces of water in a given day. Outside of that, red bell peppers, again, the colorful vegetables are all you really need to focus on. Now, exercise. This is one where everything we're doing here today is kind of in support of, if you're doing a stem cell process or LED infrared light process, this is in support of the whole thing. Exercise obviously is going to make you a healthier individual just in general, but with these guidelines here, a lot of us are still, especially the high risk group, you may not be all that comfortable going to a gym yet or getting outside around other people. So what I recommend here is simple 20 to 40 minutes a day. You can mix this up between a body weight movement. You can have weights if you have them, bands, things like that, and cardio movements. So body weight movements are gymnastics. So you're talking about things like push-ups and lunges, squatting, bear crawls, lunges, step-ups, things of those nature. If you have weights, you can do a variation of those movements, including weights with them, and add some other things in there you can't do when you don't have weights. Cardio movements is basically you just doing something to get your heart rate elevated. This could be climbing stairs, could be walking hills, jogging and running if you're capable of doing that. Good, good. For your high-risk individuals, if you're kind of fearful of leaving the house or don't feel comfortable leaving the house, you can look around your house and look for objects that you can always use instead of weights. So backpacks, books, things like a book you can put on the floor and do a step up on. If you have stairs in your house, you can walk up and down the stairs. So I promise you going up and down stairs for 5 or 10 or 15 minutes is going to increase that heart rate for you and give you that cardio aspect of the movements. When you think about exercise, whether you're high risk or regular, if you're stuck in the house or not able to get to a gym yet, try to use your imagination. Think like a child would at a park or playing at a playground, and use your imagination on the movements and things you can do. Try not to think of your normal foundation movements and exercise, quote unquote. Just use your imagination and have some fun with it. When it gets to, with the exercises, to kind of get ideas of what you can do, you can always go to YouTube, look up home exercises. If you get stuck with any ideas on what to do, just think, I'm a human, I want to move. It can be 20 minutes of stretching. It can be 10 minutes of doing push-ups. It could be walking stairs and doing push-ups mixed together. Just kind of use your imagination with that. And YouTube has a great array of things from yoga to stretching to exercise. For the rest out there who are wearing masks a lot of the time, just your day requires that. Keep in mind that wearing a mask limits the amount of oxygen you actually get to your body. So Dr. Goswami mentioned earlier about the stress response and how you respond to stress. So when you do wear a mask and you limit that oxygen, you do have a little bit of carbon dioxide buildup within that mask. I don't want you exercising in that environment. That creates a little bit of toxicity inside the lungs, which is not going to be healthy for you. So when it comes to that exercise, even if you're a high-risk group, try to find some place where nobody else is at. Try to be outside where there's sun and fresh air. Get the mask off for 15, 20 minutes, and just move around in that environment as best you can. That's going to clear your body out, help your lungs and your heart and everything like that. But more importantly, it's actually going to help your head. When your head gets cleared up, your interpretation of the stresses in your body and things outside of you that you have no control over will allow you to deal with that a lot better. The stress response in the body is just bad. And we talk about nutrition, what we're talking about with sugar and processed foods is the stress load and the stress response of the body. We get to exercise is a good means to get stress out of your body, but it's also a way to deal with all the stuff that's going on in your world as well. With the mask, while vital in certain areas, if you are at work 8 to 5 and you're wearing a mask at work all day, I emphasize that you try to find 5 or 10 minutes throughout your day, 3 or 4 times, get outside, get the mask off, and just breathe in the fresh air, get some sunshine, plus you get vitamin D, which is nice, to make yourself a little healthier, also again, in the mind aspect. For those that have tested positive for COVID or going through symptoms right now, if they're subtle, all of this still applies to you. Nutrition is one of those things. When you're eating healthy and you're eating really well, it doesn't matter what state of being sick or healthy you are, it's going to help your body deal with whatever it is going on with you. If you're just tested positive recently and you're going to be quarantined for 2 weeks, the exercise stuff, make YouTube your best friend. Make sure you're looking up various things you can do in the house and use your imagination. Make sure we get time with fresh air, of course, getting into your lungs, and try to handle that stress really well. And that kind of covers the simplicity of it all. If you guys have any questions, you can throw them on there and we'll answer those.
Thank you everyone for attending. We will open it up for questions now. If anybody has anything that they would like to ask, please do so now. You can unmute and or you can put it in the chat, either way.
There. May I go?
Hi, yes. Hey,
Yeah, so did you get my text, Brooke, about my brother and niece?
I did, yes.
Yeah, so just wanted to let you know we might need your help.
Okay.
Are you making visits? Are you dropping them off on the front door? What?
Yeah, I'll give you a call.
Oh, you're
later.
muted. I think you're muted.
Sorry.
But I'm also on a, so I'm sorry if I caused any kind of weirdness in this call. I'm on a beta program for Zoom because I have friends that work for Zoom.
You're good.
So I'm on a different program. So yeah, if mine's wet, I hope it's not disrupting things.
No, you're good. I'll reach out to you on how to.
I don't hear you.
Treatment.
Brooke. Could be me. Does anybody hear Brooke? Rosina, do you hear Brooke?
I should. Do you hear me?
Yeah, I can hear you, Brooke.
Okay. So yeah,
see.
Leslie,
Okay.
I know Leslie, Amy is doing treatments too. She has people that she's treating for COVID. I think she actually has a machine, but somebody in her circle has it. So you can also get treatments there, but I'll give you a call later about it.
Can you hear me?
Yes, we can hear you.
Yeah, I'm not hearing you guys. I think it's on my end. Sorry.
Yeah. If anybody has any other questions, you can type them in. Okay, well, with that, I guess we will.
Yeah, now I hear you.
Okay.
Sorry
Hey,
about
I'll call you. I'll call you later about it. I have a solution for you.
Gotcha.
Okay.
Thank you. Thank
You're
you.
welcome.
Cool.
Thank you for joining us.
And then to view the recording, can we just click on it and it's a
You might be
demand?
able to. I don't know. It's a new system. If you want it, just send me an email and I can send this to anybody that would like as well.
Okay, great. Yeah, I'd like to share it with them.
Great.
Thank you.
Thank you.
Thank you so much.
Should we wrap it up? Okay. Well, thank you everybody for joining our first webinar. We plan on having these relatively frequently on different topics. So we will keep you all informed.
Yeah,
Great.
thank you so much. Thank
Thanks,
you, everyone.
Rosina, too.
Thank you.
Hey,
Stay blessed.
bye.
Bye.